What are the specific therapies to treat your myeloma? Well, first there's radiation therapy. Occasionally patients can have solitary focuses of myeloma, and when they do, we can cure them with radiation. That's pretty rare, however. More often, radiation is used to treat bone pain or to prevent or treat an actual fracture. Second, there are steroids. Drugs like Decadron or dexamethasone, Medrol or prednisone. These are used for lots of other diseases, so they're not specific for myeloma. And then there's chemotherapy. Drugs like melphalan, Cytoxan, adriamycin, and Doxil are the most common four we use in myeloma. And then there's a lot of new drugs over the last several years that have been now made available for myeloma. Drugs like Velcade, Revlimid, thalidomide, and arsenic trioxide. The best news is when these drugs are either combined together or with the older drugs like steroids or chemotherapy, they can be much more effective and be given at lower doses. That means not only more likelihood that you're going to respond, but you're going to tolerate them better because we're using less of them. And last but not least, there's clinical trials. It's important to avail yourself of the opportunity to go in the trial because you're going to help a lot of other patients, and you also may be able to get drugs otherwise that would not be available to you. But we have to not only take into account knocking out the myeloma, we have to deal with what the myeloma is doing to the rest of your body. It can affect your bones. So as I said, radiation may help with that, but we now have drugs that can help as well. Drugs called bisphosphonates and monthly infusions of drugs called either Iridia or Zometa can help reduce your bone pain, your chance of fracturing, and thus the chances that you're going to need either radiation or surgery to treat a fracture. Also importantly, patients, as I said, can be anemic. So treating the anemia with drugs like Procrit or Aranesp, shots that are given either once a week or maybe every other week, can help a lot. Many patients also have low iron levels, and giving iron can help boost the performances of the drugs like Procrit or Aranesp. Last but not least, as I said, the antibodies can clog up your kidneys and your kidney function may be affected. So it's very important to get on board a nephrologist early on in your case. The nephrologist can help you very much to control the kinds of drugs you're getting and your fluid status. You may require dialysis as well. All of this together will help us formulate a specific treatment plan for you. So next, how do we determine whether that treatment plan is working for you?